in all three of the categories: interpersonal, administrative, and conceptual skills. Our hospital uses the vertical model of an organizational structure, so it's kind of like everyone is stacked on top of each other. The skills that I think I would need to use to secure resources such as staffing would be my interpersonal, because you can form a bond and a relationship with your staff and make them want to work as a team and want to come in and help out their teammates if things aren't going all that well that day and if you need extra people. Also administrative, so that you can delegate and move people where you need them so that you have all the holes filled for the staff and matrix. One thing that I thought about when I was thinking about that was in my article this week that I chose from the Journal of Healthcare for the Poor and Underserved. Dr. Ree made the comment, a healthcare team is like a sports team, except for instead of points, we are dealing with people's lives. So, if you think about the healthcare team as a sports team, then it helps kind of build that team spirit and the feeling of wanting to help each other out and wanting to do what you have to do and what's best for the patients. How would I use the published literature in the process? Well, like I just said, it tells you how to build a team, not just with the nurses, not just with the manager and the nurses, but with all the people who are involved in the healthcare team, the doctors, the nurse aides, pharmacy, everybody involved has to work as a team for the patient's goal to be met. So some departments that you need to work with in order to be effective in the role as a nurse manager. You definitely have to work with like the director of nursing and people who are above you in the way of nursing. Also, you have to work with the physicians and the head of the physicians at the hospital to make sure that their needs are being met by the nursing staff and that they're doing what they need to do for the patient's best interest as well. My preference between a vertical and a horizontal model, I've never really worked in the horizontal model, but just from the research that I've done, I think that I definitely prefer the vertical model, just because somebody is always above you to keep you accountable, and it just helps with the chain of command and knowing who to go to. And if the person above you doesn't do anything, you can always go to the person above them if you have a problem that's not being solved by the people above you. So I think I like the vertical model better because of that aspect. So anyway, that is my blog for the week, and I hope you all have a great week.